When a woman reaches her late 40s or early 50s, her bones break down faster than new bone can form. They become brittle and more likely to fracture. In tonight's Prescription Arkansas report, Ann Jansen shows us the latest technology used to test bone density.
Ms. Rollins, hi, I'm Laura. I'm going to take care of you today. Have you had a bone density before?
Having a bone density test is easy these days.
The scanner that checks your bone mineral density is a tabletop scanner. You lie upon the table, and an X-ray source sends a low-energy beam to scan the spine and the hip.
It's something every woman approaching menopause should have.
It's known that women who are menopausal can lose up to 30% of their bone mineral density in the 10 years that follow menopause. That can lead to an increased fracture risk. That can lead to the threat of either a fracture of the spine or a fracture of the hip. Weight-bearing bones are most at risk. So rather than waiting for that silent process to continue, it's much better to know about it.
At age 50, Deanna McAllister had no idea she had brittle bones until it was too late.
I was working and moving some boxes, and I hit my feet, and I fell down, and I had a compression fracture in my back.
That's when her doctor ordered her to have a bone density test like this.
After that, he found out that I was what was called osteopenic, which is just kind of a step before having osteoporosis. There had already been some bone loss there, so he was very concerned about it.
In years past, the only options that we had to offer patients were to increase their calcium intake, increase their vitamin D intake, and hope for the best. And in reality, in recent times, a number of drugs have become available that can slow or reverse the loss of bone mineral density.
They put me on a drug called Fosamax, and it just helps prevent any future bone loss. So hopefully it'll prevent me from actually going into having osteoporosis.
Deanna says the fact that she has already suffered one serious fracture makes her cautious when it comes to physical activity, but doctors suggest exercise as one of the things to help keep bones strong.
Exercise, calcium intake, vitamin D intake all act together to improve or maintain your bone mineral density. So yes, it's appropriate to be concerned about the potential for a fall, but that shouldn't keep you from your daily exercise routine.
Ann Jansen, today's THV.
This latest scanning technology delivers less radiation than the old CT scan method.